Hi, welcome to the Power of Team video series. My name is Janice Scott, always proud to be your president and CEO. And I'm really excited today. Our 17th Power of Team video is here on 66 Wellington Street, where we have our renal dialysis outpatient program. And I'm joined today by Wendy Hood. Wendy, welcome to the Power of Team video series.
Thank you. Welcome to our unit.
Thank you so much. Wendy and I actually are going to have an exciting morning. We're heading out to go to a patient's home, and we're going to see how Mr. Morrison undertakes his home peritoneal dialysis. So before we talk more about the program, I'd like to know a bit more about you.
So I got into the renal world, the kidney world, because my daughter had some kidney issues when she was a child, and that really inspired me to learn more about the kidneys. And from there, I went into hemodialysis and then transitioned into the multi-care kidney clinic and peritoneal dialysis.
That's fantastic. I mean, as the program has been growing, you've been growing along with it.
Yes, and it's been a very exciting time for us to become a regional unit of this area.
What does it mean to our patients to be able to undertake their peritoneal dialysis in their home?
So peritoneal dialysis for our patients, there is two different types of ways of offering peritoneal dialysis. So the gentleman that we're seeing this afternoon is on a night cycler, it's called. So he does his dialysis while he sleeps. And then other folks are doing dialysis during the daytime. It's still within their own home, but it allows them the flexibility. It allows them to really take control of their health.
So we've just talked about having care in the home. So can you tell us a little bit about the patient we're going to meet?
Yes, so Gord has been a peritoneal dialysis patient of ours for a few years. He has embraced this new Omnia machine that we've introduced to our patients, and he is loving it.
Let me begin though by sincerely thanking you for allowing us in your home. So you now have dialysis at home, and I understand you choose to do your peritoneal dialysis at nighttime.
Correct.
So tell me a little bit about that experience. What do you do, and how do you sleep, and how do you feel that you're monitored safely by RVH's renal hub program?
I was able to get this, I think the second or third Omnia machine, and it's slick. It talks to you.
Did the device produce audio alert?
They've really improved the situation, and if you have a problem in the night, just phone and someone from the kidney clinic there to assist and say, shut it off, send it back, do whatever's necessary.
So can you talk a little bit about how this affects you in terms of maybe both your flexibility, but also ensuring that Gord's well taken care of?
I would say the biggest benefit to having this at home has been the freedom in the daytime. The day is ours. We can go out for lunch, we can go out for dinner, see friends. It has made a huge difference compared to driving to hemodialysis, where still the people were wonderful. However, it's a 40-minute drive there and back, and you're there for hours.
Team RVH is working to make sure this is working for you.
Oh, absolutely.
Well, we just had a great morning in Wasaga Beach, visiting Gord and Sue in their home, and seeing how they're not just coping, but actually thriving with chronic disease of kidney disease, and how our regional renal hub and Team RVH have made and continue to make such a difference in their lives. We often focus on the fact that we are a very busy acute care regional health center, and I think today's visit just continues to remind us of the important role we play in chronic disease and in people's lives where they live, and where they know that we're still making a difference well outside the walls of our organization.